Hello, Shell Point. I'm Tammy Frazier, your Medical Center Administrator, here today with another Medical Center update. Because you wanted to know what is a nurse practitioner and how are they different than a physician. Determining whether you need a traditional doctor or a nurse practitioner can be difficult, especially if you aren't sure how they differ. I hope today I can help you understand the differences between a physician and a nurse practitioner. According to the American Association of Nurse Practitioners are trained, licensed, and independent healthcare clinicians that concentrate on managing patients' health conditions, including treating injuries and illnesses, as well as providing preventative care. They are licensed as advanced practice registered nurses. Nurse practitioners usually specialize in a specific medical specialty. At Shell Point Medical Center, our nurse practitioners are specialized in adult medicine. Nurse practitioners are required to have a master's degree in nursing to practice and can spend hundreds of hours performing supervised clinical work. They can function well as primary care providers because their background includes knowledge of both holistic and wellness-oriented programs, which spotlight education, risk identification, and preventative care. Doctors are formally trained in medicine, meaning the treatment of disease through medication, medical procedures, and sometimes surgery. Like a doctor, nurse practitioners are licensed to diagnose conditions, treat patients, and write prescriptions. In many cases, doctors and nurse practitioners perform the same functions, such as identifying and treating acute and chronic illnesses, ordering and analyzing labs and other diagnostic tests, as well as have the authority to write prescriptions. In the state of Florida, it is required that nurse practitioners work under the supervision of a physician. Nurse practitioners are licensed by the nursing board, whereas doctors are licensed by the medical doctors board. The biggest difference is accessibility. The United States is facing a shortage of doctors all over the country, particularly in primary care. Because of this, many hospitals, private clinics, and urgent care locations are relying upon nurse practitioners to fill the excess need. According to Bloomberg Business Week, the United States is facing a shortage of 13,000 doctors, which could grow to more than 130,000 within 12 years. Meanwhile, there are 155,000 nurse practitioners willing to fill that need. In the near future, that could spell more freedom for nurse practitioners to practice without supervision. Understanding the difference between nurse practitioners and traditional physicians can be difficult because in many cases their job descriptions overlap. The key differences are that many states like Florida require nurse practitioners to have physician supervision and that medical doctors have more extensive and comprehensive training. However, for most patients, it comes down to trust and common sense regarding the level of care that they have been provided. Please continue to email your questions to me at tammyfrazier@shellpoint.org and know that it's our pleasure to care for you.